Hello and welcome. For those of you who I have not had the chance to meet before, I'm Dr. Richard Nongard. I'm a licensed marriage and family therapist, and I'm a certified clinical hypnotherapist. I've worked with individuals for the last 25 years using hypnotic modalities to help people to not only achieve their goals and change habits in life, but also to recover from illness and to assist them in experiencing comfort during periods of life where difficulties may arise. That certainly includes the area of a diagnosis and the treatment for cancer. I'm not a medical doctor, and I'm not going to be giving you specific prescriptions or treatments for your illness. But what I am going to be doing is providing you with self-hypnosis resources, which are based on a wide body of clinical evidence that have been shown to help people modulate some of the symptoms and the distress related both to the diagnosis as well as the treatment of various types of cancer. There are 6 videos, there are 6 MP3s, and there are 6 downloadable PDFs. I'm going to share with you what the content of each part of this program is all about. The videos are really just a short learning session. I'm going to take probably about 5 minutes, maybe 10 minutes in each video and share with you some things that are useful to you as you prepare to use the MP3. The MP3 really is the star of the show, and you can do 2 things with it. You can use it online, or you can download it to your phone or to another portable media device, and you can actually listen to these full-length hypnosis MP3 sessions at home, at the hospital, at your office, or really anywhere that you would like to. The third component of this are resource scripts for clinical hypnotherapy professionals. These are downloadable MP3s that to some extent correspond to the MP3s. And professional hypnotherapists who are utilizing this program with their clients will find this is a valuable tool for the therapeutic services that they provide. There are 6 categories or 6 topics which I address in this series, and they really don't go in any order. You can utilize whichever session would be most valuable to you at this time. Different patients with different types of cancers and different types of treatment have a variety of different needs. And so this is not go through 1, 2, 3, 4, then 5, then 6. This is simply pick the resource that you feel would be most valuable to you at this particular time, watch the video, and go through the MP3. I do recommend with most of the hypnosis sessions that you listen to it several times. People experience hypnosis in different ways and at different levels. Sometimes people go into a deep state of relaxation, experiencing the process, but not necessarily listening to the words. That's okay. Sometimes people pay careful attention to each and every word, going through the process, sometimes even struggling with the process a little bit, and that's okay. There's not a right or a wrong way to experience these MP3s. They're really designed more than anything else to teach you specific skills. Now, this first session focuses on anticipatory and chemotherapy-induced vomiting and nausea. The reason why this is session number 1 is because many people are drawn to this program, and many people ask me in my private practice specifically for hypnosis related to nausea and vomiting during a period of chemotherapy treatment. So I made that first, but again, you can choose whichever one would be most valuable to you at this particular time. The second session focuses on pain control strategies. A couple of ideas that you can actually utilize to increase comfort despite illness and surgery and processes of treatment, and decrease pain or discomfort. A lot of people who are undergoing a variety of different treatments and experiencing the difficulties associated with cancer often report to me that they have sleep disturbances, that their mind is racing at the end of the day and they have a hard time falling asleep, or they're simply uncomfortable. And because of the discomfort, it's difficult for them to sleep. Other people have told me that they're actually afraid to go to sleep. All of these things are certainly understandable, and so session number 3 focuses on sleep disturbances And the MP3 actually lets you, at the end, drift off into a deep and relaxing state of sleep. Many people have told me when listening to this MP3, this is one of the most valuable parts of the program to them. The reason why is, after listening to that MP3, it was the first time they've gotten a good night's sleep in several weeks or even in several months. Now, the fourth session focuses on increasing energy levels during treatment and recovery. The reason why this is, of course, important is that side effects of certain medications, again, various tasks that need to be accomplished, ranging from laboratory visits to doctor visits to surgical procedures, etc., can be tiring. The illness itself can bring about fatigue, and the research tells us that hypnosis is not only a great tool for getting a good night's sleep, but can actually be utilized to increase our energy levels. And I'm going to teach you some strategies for increasing energy levels in the face of fatigue during cancer treatment. The fifth area focuses on anxiety, your mood, and stress. These are big issues from an emotional perspective. And again, these MP3s and these videos are not a comprehensive treatment. None of these replace medical care, medication, or professional counseling. But the strategies in this fifth session on anxiety, mood, and stress are based on the research and can help you to detach from negative thoughts, negative feelings, and actually associate into a positive state despite the difficulties which may be around you. And the sixth area is a session that I've specifically prepared based on the need for individuals to prepare for surgery. Often people call me immediately preceding surgery after receiving a diagnosis, and they say, I don't know what to do. I'm having surgery here in 10 days. I just got a diagnosis 2 or 3 days ago, and I'm going in for my most recent client, a double mastectomy, and I'm really at a loss here. Pre-surgical preparation is really important. Not only can it help a person deal with anxiety, but the research actually shows us that clients who learn hypnosis and the techniques of hypnosis and mindfulness-based stress reduction prior to surgery have a greater chance of experiencing 3 specific outcomes. 1, a decrease in complications. 2, an increased speed of recovery. Wouldn't that be awesome? I have clients who their physician often tells them it'll be 4 to 6 weeks post-surgery before you feel like getting up and around again or whatever else. And often clients come back 2 or 3 or 4 weeks, saying that they're surprised at how well they're doing, and their physicians are often surprised by that as well. And the third thing is that clients who learn prior to surgery specific techniques of relaxation and utilize visual imagery can actually reduce the level of anesthesia needed during surgical procedures and the likelihood of dependency on pain medications and other medications post-surgery. Now, all of the techniques and all of the strategies in this program are all based on the research. And since the first topic, and the topic of this video and this MP3, is chemotherapy-induced nausea and vomiting, I'm going to share with you the first citation. And each of these PDFs and each one of these videos includes a reference and an abstract describing how the techniques of clinical hypnosis can be useful in mitigating some of the unpleasant side effects of treatment. The first citation comes from the European Journal of Cancer. It was published in 2007, and the title of the journal article is Hypnosis for Nausea and Vomiting and Chemotherapy, a systematic review of the research evidence. What's great about this citation is that it looked at multiple studies. And this study said, to systematically review the research evidence on the effectiveness of hypnosis for cancer, chemotherapy-induced nausea and vomiting, a comprehensive search of major biomedical databases, including Medline, EMBase, PsycInfo, the Cochrane Library, and other resources was done. The study then looked at randomized controlled trials. They were appraised under a meta-analysis. Clinical commentaries were obtained, evaluating the effectiveness of hypnosis in chemotherapy-induced nausea and vomiting. Some of these studies, the participants were children. In others, they were adults. Without reading the entire abstract to you, I'm going to summarize or read you the summary here. Meta-analysis has demonstrated that hypnosis could be a clinically valuable intervention for anticipatory and chemotherapy-induced nausea and vomiting in children with cancer. As all journal articles state, further research is always needed. But the major conclusion from this article is that studies report positive results, including a statistically significant reduction in anticipatory and chemotherapy-induced nausea and vomiting. And that's the key line in this abstract, which really is important to us. Now, if you've never experienced hypnosis before, whether to this MP3 or one of the other MP3s, you're going to find a comfortable place, sit in the chair, or you can lay on the bed if you'd like. That's okay as well. And again, you can listen with headphones. I always prefer listening to hypnosis with headphones, but you can listen without headphones as well. It is your time to learn strategies which can help you to feel better. The idea behind the hypnosis MP3s is to simply listen to them with an open mind, following the suggestions that I give. Almost all of the MP3s use what in hypnosis we call an induction, a time of relaxation, focusing on the breath and physical relaxation. There are many benefits of physical relaxation. It's something that is really important to the healing process. And when we achieve a state of relaxation, I then utilize what in hypnosis we call suggestive therapy. This might be visualization, or it might be what we call direct suggestion, or it may be some other form of suggestion. Now, these suggestions don't come from me. They actually came from you. I know what suggestions are important to you because you've chosen to listen to these tracks. And I'm basing the content of all of these suggestions on what the journals suggest is an effective way of approaching the subject in each one of these areas. Now, it's perfectly okay for you to move. Sometimes people wonder, will I be asleep? No. You'll simply be deeply relaxed. Sometimes people wonder, what if I open my eyes? That's okay. You'll be able to look around and see the room around you and close the eyes again. Sometimes people say to me, but what if I hear a noise outside the room, or there's something else going on? That's okay as well. That can simply reassure you that you are exactly where you need to be, doing exactly what you need to do. There's really not a right or a wrong way to experience these tracks. You can listen to them on a daily basis, or you can listen to them as you need them. That's fine as well. You can listen to them in the morning, the afternoon, the evening. It really doesn't make a difference. The one thing I will ask is that you do not listen to these while you're in a motor vehicle. Whether you're driving or somebody else is driving makes it really hard when you get to the part that says, now close your eyes to drive a car. And of course, the person driving the car will be listening to whatever you're listening to, unless, of course, you're using headphones. I hope that you enjoy this series. I think it'll be very beneficial to you. If you ever have any questions about hypnosis in the course of cancer treatment, you can always contact me at my office number. My website is subliminalscience.com, www.subliminalscience.com. And you can always post any questions at our online internet forum at www.icbchgroup.com. So that's icbchgroup.com. I, as well as many other hypnotists, will take the time to answer any questions that you have. I'm really glad that you've decided to participate, and I look forward to your wellness and your success as you participate in this series of resources designed for those who are undergoing cancer treatment.